Somalia's Equity Town, wherever down there are common and fatal bombshell blasts, just has one complementary emergency facility, that was based by Abdul Qadir Abdirahman Adan 13 years back. While he refundable of Pakistan, wherever he had been student dental treatment, to Mogadishu as a crisp grade he was affected by the absence of ambulances on the lively gateway, and human beings with wheelbarrows to ferry boat the patient to clinic. The really few ambulances how did already exist, an answer to telephone call came of individual hospitals and patients had to pay for their gallery. So not length following his back, Dr. Adan solved to begin an emergency facility. He begun to work the van, transport the injured and the hard pregnant woman to the clinic. Such a was the consumer demand for the facility how he implemented it necessary to extend, and he began frequenting the town's outdoor air markets and angle shops, looking for capacity donors. I controlled to persuade a team of regional entrepreneurs to microchip in and buy us else van, he says. At the period Dr. Adan was a portion-time coach at a pair of universities in the town. I requested my students if they requested to rescue a lifetime, and if they did, to sacrifice a $1 pound a monthly to assist rescue our brothers and sisters, he says. Quickly anywhere he went, he began to ask human beings to promote a $1 a monthly to assist run Aamin emergency. Aamin tool confidence in Somalian, and largest residents of the town since it has lived up to its behalf in a community unsuccessful by its political community. Up to 42 telephone call a day, 20 ambulances, 35 members of personnel present. Aamin emergency, that survives on grant, has a personnel of 35 human beings. Lot of them are voluntary and students, Dr. Adan says. The voluntary are not pay a wages, but several of their cost, such as transport, are coded. The facility has a navy of 20 ambulances and a motorist for every car. We work on grant. We don't get any financing or assist of by the government. A time back, we requested the Mogadishu Mayoress's office space if they could help us in 10 liters of gasoline a day, but we are yet wait to listen on how. But Dr. Adan has been capable to draw several supporting of the joint nations. Who this Planet Public Health Organization purchased us 2 cars. UNDP sacrificed several walkie-talkies, the 45-year-old says. We purchased other hand ambulances of Dubai and had them brought there. Newly, the UK legation in Mogadishu organized a part marathon to lift cash for our facility. Increase cash can be difficult job, as is behavior in the town authorities that newly prohibited Aamin emergency of visiting explosion scenes. The difficulty of the issue seemed to be by the government's susceptibility on lost figures of bombings transferred out by Islamic militants. Aamin emergency frequently keeps journalists upwards to date on which its paramedics include observed with public print. But Dr. Adan tested to act downward the dispute. I tell to the police force commissar, who rescinded the ban, but he said us to let them aware while we are visiting to an disaster. We are not permitted to say to the print or say on the flesh calculate. For Dr. Adan, such a headaches can be surmounted as he is hardened by the liberality he has skilled with start the emergency facility. Each man in the lifetime has a goal, and the largest precious item for me is humane lifetime. How is my drive strength, he says. Somalis are really lavish human beings, though while they include anything. Our nation has been in confusion for 30 years and it is just busy since of cash shipped of overseas. Our nation has been fleeing on the liberality and goodwill of Somalis in the diasporas for many decades. Aamin is nearly a collaborative society force, we include had to get the reins for the so-being of our comrade Somalis. Though Mogadishu has been in the news story for bombings transferred out by the belligerent team Al-Shabaab, Aamin emergency facility is not exclusively transferred out of the requirement to visit to these types of attacks. Mr. Adan says the ambulances go wherever they are necessary, if it is to visit to a little kid, a female departure in labor or an old man in requirement of aid. Whatever vary and nobody who is necessary our assist, we include paramedics and medical staff prepared, he says. For the next, Dr. Adan envisions a Somalia wherever know as necessary to die since they are incapable to get assist in period. He would love to see Aamin emergency extend to lid the entire nation. It may appear love and hardly sight as Al-Shabaab yet controls largest village areas, but Dr. Adan is anything if not established. And Al-Shabaab, named for needing protect cash of lot Somalian business community, though in Mogadishu of wherever it was sent in 2011, does not appear to squabble Aamin emergency. We're not a industry, we're not manufacturing a income and we're not policy. I can't perhaps see which Al-Shabaab would wish in us, says Dr. Adan.